So in our project, we did the effects of non-contingent reinforcement on problem behavior. So this study examined the effects of non-contingent reinforcement on problem behavior maintained by attention of 3 young adult males with a developmental disability. This study found that attention-maintained behavior was significantly reduced when participants in the study were provided with NCR via verbal praise on a FI schedule and then to a FI7, FI10, and then FI12, and finally FI15. An ABA-B withdrawal design was used. Each time NCR was withdrawn, problem behavior increased. The results of the study indicated attention-maintained problem behavior significantly decreased when NCR is used as an intervention. An intellectual disability is a disability characterized by significant limitations in both intellectual functioning and in adaptive behavior, which covers many everyday social and practical skills. And the most important thing about this is that this disability originates before the age of 18, and this is according to the DSM-5. So this study shows, or many studies show, that individuals with intellectual disabilities are more at risk of displaying challenging behaviors than the average population. And then the use of non-contingent reinforcement is an antecedent intervention frequently used to treat challenging behaviors and is common treatment for persons with developmental disabilities. It is defined as an antecedent intervention in which stimuli with known reinforcing properties are delivered on a fixed time, also known as FT, or a variable time, also known as VT schedule, independent of the learner's behavior. Participants in this study were 3 young men who all have a diagnosis of high-functioning autism and currently live in a community integrated living arrangement managed by a disability service agency. All of the young men attended the same developmental training program Monday through Friday from 8:30 a.m. to 2 p.m. They are all independent with activities of daily living and enjoy well-developed leisure repertoires. A little bit about the boys. Jason is a 22-year-old male diagnosed with autism whose problem behavior consisted of property destruction. The second boy, his name is Henry. He is a 24-year-old male diagnosed with autism who engaged in screaming. And the third male in our study is named Anthony, and he is a 26-year-old male diagnosed with autism who stuffs the toilet with toilet paper. All of the sessions took place at the Developmental Training Center in rooms approximately 750 square feet. Each room had a table, chairs, computer, and all of the materials necessary to conduct the study. So property destruction was defined as any instance of Jason damaging personal or public property, for example, breaking an object into 2 or more pieces, using an object to break other objects, ripping objects or parts of objects from walls, floors, or furniture, and denting cars, objects, or walls. Screaming was defined as any instance of Henry vocalizing at a volume above normal conversational level for any period of time. And finally, stuffing toilets was defined as any instance of Anthony attempting or successfully placing excessive paper products in a toilet drain. In an effort to decrease each participant's engagement in problem behavior, NCR, the independent variable of the study, was provided as an intervention. The study used an ABA-B withdrawal design to determine the efficiency of NCR, and an intervention for problem behavior maintained by attention in 3 young male adults. So once baseline logic was achieved for all of the participants, the intervention variable NCR was implemented, in which staff were working with the 3 young men who were trained to provide verbal praise and attention on a fixed interval 5. Staff would verbally praise each of the young men every 5 minutes throughout the 6-hour day in an effort to prevent ratio strain. The enforcement schedule was thinned to a FI7, then an FI10, then an FI12, and finally an FI15. The staff were observed and monitored daily by the BA to observe procedural integrity of the implementation of the intervention, and then after 6 weeks of the intervention, NCR was withdrawn and conditions were returned to baseline. The independent variable was returned after the 6 weeks and returned to baseline phase. And then a sociability questionnaire was completed by staff at the conclusion of the return intervention phase of the study, which basically asked their opinion on the degree of the NCR intervention helping with the problematic behavior, and then how the NCR intervention helped decrease the problematic behavior, and then finally the procedures that were taught to them. How was the design of those procedures in the intervention easy to follow or extremely hard to follow? During the baseline phase of the study, each of the 3 participants engaged in problematic behaviors. ABC data collection indicated that the problem behavior occurred more frequently for each participant when there was less staff in the room, resulting in a lower staff-to-client ratio. A higher staff-to-client ratio often produced an attention deprivation condition, making it more likely for each of the participants to seek attention through engagement in maladaptive behaviors. During the intervention phase of the study, problem behaviors decreased very quickly and significantly in each of the behaviors of the 3 participants. Engagement in the problem behaviors remained low until the intervention NCR was removed at the 13th week of the study. At the time, all problem behaviors quickly escalated. The frequency of the problem behaviors remained high during the return to baseline phase. Once the NCR was reintroduced in the final intervention phase, participants' problem behaviors quickly decreased. Figures 1, 2, and 3 provide a visual analysis of the frequency of problem behaviors for each participant in each phase of the study. The results indicate NCR effectively reduced attention-maintained problem behavior in 3 young men with a developmental disability. The results of the study suggest NCR as an effective treatment for problem behavior maintained by attention. This finding is in agreement with findings of other research studies on the topic. Some potential threats to internal validity of this study that were not controlled for were instrumentation and participant illness. In regards to instrumentation over the course of the 24-week study, staff could have changed and the new staff might not have received the appropriate training to collect data for the study. Additionally, there were no procedures in place to document whether or not participants' low-frequency problem behavior during baseline was not the result of illness. If participants reported they were ill on a particular day, they may not have had the strength to engage in problem behavior. Threats to construct validity included the attention and contact according to the client. During the study, participants gained significantly more contact to attention from staff and the behavior analyst, which could have accounted for the results of the study, particularly since the problem behavior was attention maintained. Meaningful ways that future research might enhance the external validity of this study include, first, generalization of the study across subjects. This could be done by selecting participants across 2 or 3 agencies that serve individuals with developmental disabilities, instead of limiting participants for a single agency. Second, the study can be generalized across settings. Instead of focusing in on problem behavior at a developmental training program, problem behaviors that occur in the community integrated living arrangement can also be included. This would also lend itself to number 3, generalizing across time of day. This study focused on problem behaviors occurring between the hours of 9 a.m. and 3 p.m. at a developmental training center. Fourth, future studies can reduce reactive assessment by training multiple staff members who typically work with participants in the data collection procedure. In this study, the BA, who worked with participants less frequently than staff, participated in the data collection procedures. It is possible that the participants reacted to the novelty of the presence of BA in the classroom more frequently than usual. Finally, training more contingency managers would also lend itself to generalization across behavior change agents.